The following was recorded in front of a live studio audience at the Studio 21 Podcast Cafe. This is the United Podcast Network.
Welcome to the Quirky Dog Podcast, inspired by some of the quirkiest dogs you can ever imagine and the owners who love them. This podcast is brought to you by the quirky couple themselves, Scott and Jess Williams. Their aim is to educate and entertain. Here's Scott and Jess.
Welcome, guys, and happy Wednesday. Today we are going to talk about wounds. I thought it would be a good topic to talk about. Some people may think we may be talking about studies or acronyms in the dog world, but let's just help people. So we are going to spend this whole episode talking about wounds, but first we're going to start with the quirky tip of the day. Oh, the pig has this cone on. All right, my quirky tip is, if you follow along with the Reels, people are loving the Reels. They're on YouTube, they're on Instagram, they're on Facebook. A lot of the Reels are Jess. It's AI generated. I have nothing to do with the Reels. AI just must like me. I just must make some very poignant points during the podcast. So if you follow the Reels, it's not Jess's ego taking things out of control. It's just the way AI perceives the quirky dog. All right, today we are going to talk about wounds because we've been dealing with a lot of wounds lately, for one.
Well, we had one dog that had a very persistent issue on the elbow.
He had an abscess.
And we went through 15 different ways to treat this thing to get it to heal up. So that's kind of maybe the catalyst of this
and we've had a dog that had an eye issue. And just over the years, we've just dealt with a lot of situations with wounds. And of course, we're going to start this off by saying, go to your vet, contact your vet, get advice from your vet. This isn't so you're doing all of this at-home care, but sometimes when the vet says, keep your dog away from the stitches or keep your dog away from this sore or keep your dog away from this bump, people have a very, very, very hard time doing that. And it's not just because they're not following protocols, it's because sometimes the dogs can be quite difficult. So we're going to
this can prevent going to the vet too. You got a small issue.
Yeah.
If you can keep the dog from making it a bigger issue, then you don't have to go to the vet.
Yeah. So we're going to do a little bit of a show and tell episode. And I guess the best way to kick that off is with the cone. This is known as the Elizabethan cone, or some people call them an e-collar and everything else.
Cone of shame, I've heard it referred to.
The cone of shame, yes.
And here's our little pig with his cone on.
Yes, the pig has the cone, but I need to really show the difference here. So these you can purchase, I believe they're Kong brand. No offense to Kong brand, but they're Velcro. And you can purchase these at a lot of pet stores. This is like the new go-to retail cone. This is not my favorite cone. Dogs can easily scratch this off. I'm not crazy about this cone. I love the one that most vets carry, where you have to construct it and put it together, and then it has loops in the end. And a lot of times,
put some ribbon or a collar.
Yeah, a lot of times they use this ribbon that they give you. But if you have a collar strap, you can put your own collar strap through it. But literally over the years, I have had these cones in every single size. When the stuff starts, coming apart, I duct tape the ends together. I've put cone extensions on cones for dogs that they're not large enough. So the cone is your friend. It really can save you from a lot of stress, a lot of trouble. If your dog has a face injury, they can't be scratching at the face injury. If the dog has a, rear end injury, they can't be turning and licking that, a stomach injury. This cone is my number one go-to. Excellent for wound care. And if you are crating your dog while you're coning your dog, which should be pretty common when they're loose in the house, they're banging all over, they're knocking into things, they're keeping you up all night, you want to basically turn the dog so its butt's facing the crate and back them into the crate. That is the easiest way to crate a dog in a cone. And when Jimmy had his TPLOs, he was in a cone like this for months.
Yeah.
Yeah, because we were trying to prevent spinning. So the cone is not outdated. Yes, it is the cone of shame. Yes, all the dogs hate it, but it is an excellent way to care for wounds. So when I talk about banging into all these things, when we had the dog who had the abscess, he's like 16 or 17 now. He's a rescue, but he is an older dog. I didn't want to cone him and crate him every night, and I felt bad about that. But when he would wear that plastic cone, he'd literally be banging around my office all night and banging into the door and keeping me up, so it was driving me crazy. So he had an abscess on his front leg, and this soft cone is not to be forgotten about. This was able to prevent him from reaching over his chin and licking at his front leg, and it didn't have the same noise issues that I had with the other cones. And I bought this a little bit oversized for him because I wanted to make sure there was a lot of bulk there. And the other nice thing about this is the dogs can kind of sleep on them, kind of like a pillow, versus...
Like in the airlines.
It pretty pretty much is the same thing. But there's a blow up thing in the middle. So the soft cone is still a great go-to, but it does not prevent the dog from getting to all places. If your dog has a wound near its rear end or on its tail, the soft cone is probably, if the dog's long enough and has enough body length, they can still turn around and lick that. So you really want to be conscious when the vet says, or when you see something developing, keep your dog away from it, that you are keeping your dog away from it. This is a huge, huge, huge aspect of wound care and letting the dog able to heal the bacteria from them licking and their saliva and the environment and everything else can really increase the chance of infection and take a wound a lot longer to heal than it needs to. So when they say keep the dog away from it, we 100% would say do everything in your power to do that. Another great thing, I don't have one here. This is a bit of a show and tell episode, but I don't have every single thing we're going to talk about, is a t-shirt. So if you have a dog that, like when my dog had a pyo last year and she had to get spayed after her pyometra surgery, I put an old t-shirt on her. I just cut the back of it. She wore the t-shirt. I could cut the arms off because it was something on her stomach. And then I just tied a knot around the back. If the dog has a back injury or, something that was removed from the back, you can tie it around the front, around their bellies. But you just, make a little cut on the very bottom of an old t-shirt and then make sure you're tying that so it's tight. Some dogs will still move that and get through that and they don't care so much about it. But for a dog who's relatively respectful of that type of situation, a t-shirt is a great way to go to keep the dog away from it as well.
And now they sell like a onesie.
Yeah, body sleeve.
Yeah, it's like a Dr. Denim with a little... all four legs go in it, and it just covers the whole body.
Yeah, and some of these contraptions, you guys, are worth the money. I have to tell you, like, you can spend a lot of money nowadays. The billion-dollar pet industry, it is kind of nice that we have come up with a lot of solutions over the years to help things. One thing I see at our vet quite often is kind of like the sleeve I've been wearing over my hand with my finger when I originally used to take a shower, and now when I bathe dogs or something, because I don't want to always get this wet, that like big balloon sleeve. They have kind of that large sock for dogs now too, if a dog has a foot injury or something else. I have not used those personally, but I see them being sold places, and I think that's a great way to keep a dog from licking his foot, and it goes all the way up the leg versus something small like these booties, and we will get to these booties. But quality matters. So I think it was our Portuguese water dog episode. We talked about these different braces for the back legs because we did a lot of stuff. Jimmy had 2 TPLOs in the past year. He's had a lot of incisions. We wanted to keep him from licking those. This brand, which is the Lick Sleeve, officially, I guess it's called, is by far the best one we've found. A lot of the other ones have been super janky. They have not been that useful. Can you bring the pig over here? So this one is nice because you put a rear foot in it and then it actually wraps around the dog's body a couple times and then clips. Obviously, it's a little bit big for the pig, but that's what prevents it from getting pulled off or sliding up or anything else. And this was well worth the money. It was an expensive choice for this.
Probably $30.
I think it was closer to 60, but it was expensive for what it was. And at first I didn't think I needed it, but all the little crap that we bought on Amazon did not do anything. This was definitely the way to go. So this was a great...
Well, he'd wind up waking up with it not on his, the less expensive ones. He'd wake up and it wasn't on his leg anymore.
No matter how it happened, he got it off. Another kind of contraption-y thing that we used, and this brand is Silkus brand. I don't know. I should have looked that up. I got this on Amazon. But for the dog that had the abscess on the front leg, he put his leg in here, and then the other leg could go through it as well. This is a front end contraption for sure. And then it goes around the dog's back and clips. Now, the one thing about this, and another thing about wound care that's super important, is this would allow a lot of moisture to stay inside. And that was not necessarily the best for his healing. So I had to go back to the cone.
This leg is almost a neoprene. So it's almost like a wetsuit type of
so
thing.
It'll keep...
It's tough. You can't chew through it, but the wound was seeping.
Yeah, so you want to be careful that you're keeping things dry, that it's not creating a lot of fluid, a lot of moisture, whether it's an abscess or anything else. You want to keep the dog from licking it. The drier the wounds are, the better, which brings me to my next point, which is a force dryer. You guys, if you do not have a force dryer, I would strongly consider it if you have a dog with hair. If you have a dog with very short hair that's just skin with some, very, very, very short fur around it, the human hair dryer is fine. But when it comes to something like a wound, the drier you can keep it, a hot spot, the drier you can keep it, the cleaner you can keep it, the better, the quicker it is going to heal. If something has a lot of moisture in it, it's going to take longer to heal, and it's a very important consideration when it comes to this type of situation.
Yeah, some people will shave the area to keep so that there isn't hair that's retaining moisture. We haven't had to shave any dogs, but that tends to be a go-to. If you go to the vet and the dog has a sore, quite often they'll just shave an area around it so the moisture can't be in the hair, you know.
And we don't have dogs with super long hair, but if it's a Great Pyrenees or something and there is long hair and it keeps getting caught up in that and creating more seeping and more fluid and more moisture and everything else, it is going to take longer to heal. So be very, very conscious of that.
Especially if you have a neck issue, because a lot of thick hair around the neck. So if you have like a little e-collar irritation on the dog's neck, you want to get that clean and dry right away, because that can turn into a pretty big infection like within a day or two. That can get really ugly.
Yeah, a hot spot anywhere can, but the neck can sometimes blow up quicker. And like Scott's saying, keeping it clean, antibacterial soap. You can buy over-the-counter antibacterial soap, but you're washing that, you're getting the soap off, and then you're drying it. You want it dry, 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 dry. Dry is key here. We talked about this in our Happy Dogs Have Happy Tails episode. This is called dog ends. This is for tail injuries. This did not work at all for our Malinois. We have a whole other procedure to deal with for him. But it comes with these little like mesh baskets that go across the tail, and then you slip this over the tail, and then you pull this out, and then this is kind of on the end of the dog, this little mesh thing at the very end of its tail for little tail injuries. So if you have a more docile dog than Scott's Malinois, who was trained in bite work and who has bite work genetics, Cousteau, this might be a great option for you. It didn't work great for us, but it's certainly something out there that it's going to keep your dog from, if they've had a tail end injury, licking it, getting all obsessed with it, and making it worse. And it comes with a bunch of these little mesh baskets. You don't have just the one.
And I think most dogs that get those type of injuries have the pretty hectic tail to begin with. So I can't see those things really working well on any dog.
Well, sometimes they can just nick it in the woods too. It's not always happy tail from wagging and everything else. Last thing here before we go to break, super, super, super important, vet wrap. You can get vet wrap on Amazon. It comes in every freaking color these days. I have been doing a lot of vet wrap myself for my finger. I've even ordered this nude stuff. If you have a golden retriever or a dog that you don't want it to be so obvious, they have like nude skin color vet wrap. You can get it in black, you can get it in white, everything else. I love vet wrap. It is absolutely amazing. It adheres very nicely to itself, so it sticks on itself very nicely, and it is a great go-to. Now, the most important thing when it comes to any of these contraption type of things we talked about, or vet wrap or anything else, if your dog is going to take these things off and chew them and now ingest them, we're not only talking about wound care, we're also talking about a possible obstruction. So if your dog is the type of dog who's going to see this vet wrap, not only rip it off, but then maybe chew it up and swallow it, make sure you're definitely using an Elizabethan cone on top of all these other products, because the last thing you want now is, an obstruction from a t-shirt, a vet wrap obstruction, anything else. That's going to be a huge, big problem for you and more life-threatening than probably the wound you were originally dealing with.
Another thing with vet wrap you want to be concerned about or conscious of is that it has this nice elasticity to it, but you can wrap it a little bit too tight. And you don't want to have it on a leg and have it starting to cut some blood flow off or something like that. So you want to have it just snug enough to stay on there, but you don't want to get it, you're not making a brace. It's just something to cover a wound,
Yeah, definitely. All right, let's go to break super quick. When we get back, we're going to talk more about wound care.
Want to keep up with all the latest from the Quirky Dog podcast like me and Murphy here? Then make sure you head on over to the YouTube channel and subscribe. Or if you prefer to listen to the madness, go on over to iTunes or Spotify and follow the Quirky Dog podcast. And hey, while you're there, leave a rating and review and let them know what you think of the show. Until then, keep it quirky.
Okay, process of elimination here. My last gadget contraption go-to are these little booties. They are rough wear booties, and I got to give these guys full credit. They're Vibram, like the barefoot shoes for people. I got to give these booties full credit for allowing our older doodle's abscess to finally heal, because I'm telling you, that thing that we had where he had this front end contraption, he had all this moisture building up, he'd have his cone on and he couldn't lick it, and all of that was great. But the freaking dog, with his old dog dexterity, was still able to get his back leg up and scratch the abscess on the front, and it was preventing it from healing. So I bought him these little booties, and he wore these on his back legs, and this is what finally got this to heal. So I'm a big fan of the rough wear booties. Most people get these for hiking outdoors in adverse weather conditions, or maybe some proprioception as the dogs get older, but they come in a pair just like this. and they worked great for me. So if you're getting some scratching issues where the dog is trying to get to a wound by scratching it, at least this way, the nails aren't going to hit it and they're not going to reopen it. Oftentimes, even if the dog has an issue with its neck, that wound may not be that bad, but once they've been scratching at it and irritating it and everything else for days or weeks, then it's going to get worse and worse and worse. There's going to be more seeping. It's going to be a bigger and bigger deal. So preventing scratching is huge. Rough wear booties all the frickin' way.
Yeah, and that particular abscess, I mean, it was frustrating, and you see we went through like 7 or more different ways of treating this thing. And what would happen is it would start getting better, and we're like, oh, we're out of the woods, it's so much better, and then he would somehow irritate it or something would happen and it would start like regressing. So it was back and forth and back and forth. And it was like probably 5 weeks of dealing with that damn thing.
There's a lot of...
And he's old. You think, oh my God, we don't want him to get like sepsis or, get this big infection. It was like he's got a lot of life energy and he's just like fighting all of our ways of keeping him from getting at that wound.
Yeah, and that's a good point to bring up. The older the dog is, the harder it may be to heal a wound. Your immune system is not as strong as it was when you were younger. If you're an 85-year-old person and you get a little scratch, that can become a way bigger deal. You're bleeding, all of a sudden something else than when you're in your 20s or 30s. So the older the dogs get, it's important that you're really nursing these things along and helping them and their immune systems too. Which brings me, go ahead.
I just want to say, if you see something like your dog is licking a paw and it's getting to be a little hot spot, bald spot, red, don't just ignore it because it's not going to go away. The dog is creating the problem, and if you don't do anything, it's going to get worse and worse and worse, and then you're going to have to go to the vet, and it's going to be antibiotics and the cone and this and that and the other thing. So be proactive. Everything we're talking about is being proactive. We see a little issue, we're jumping on it to stop it from getting and to become a bigger issue. This is not even getting to the vet yet. This is little things happening. Yeah. We're doing all this stuff to keep it from turning into a vet visit, antibiotics, and of course we'll do it if that's what needs to be done. But we know we can prevent a lot of, things from getting worse by being proactive with these tools.
I did give the abscess dog antibiotics, don't worry, and I had some on hand just in case anyone was judging me for my abscess care. And also, with that said, yes, you can do these things on the front end. Yes, you can prevent these things. But when we get back to the immune system situation, this is a huge, huge component to consider. So we've talked about immune systems before with Manuka honey, great product to give orally, everything else. Again, consult with your vet, make sure your vet's on board. It's also great for wound care. So while I'm saying keep everything dry, a lot of times if you apply high quality, high grade Manuka honey onto a wound, it can help heal it faster too. And I want to backtrack also to what Scott was saying about don't wait too long. Your first indicator should be any OCD behavior. Don't wait until there's any hair missing. Don't wait until the dog starts chewing. Don't wait until there's an actual sore. Once you see some out of the ordinary OCD behavior or any OCD behavior that the dog has regularly, you should be intervening on the front end, okay? As soon as you see that moisture building up, that's when you want to be like, oh, something's up, I need to deal.
Another thing I would say, just before we get away from this dog with the abscess, any kind of a foot injury, elbow injury, leg injury, you may let your dog out in the yard to go potty every morning and all that kind of stuff. We started taking him out on a leash as soon as we saw what was going on because he's the type of dog that likes to just lay down out in the dirt in the sun and roll around on his back, and he would definitely pack a bunch of dirt into that wound if we allowed him to do it. And that would be dirt that had been peed on. It would have just been nasty stuff. So he was going to a special area on leash to go potty every day until he was healed up because we didn't want any infection to happen with this wound. So if you have a dog like that, just be conscious of that too. I mean, they go walk and step and poop with a little cut on their foot. It's not a good thing.
Yeah, bacteria is not your friend when you're dealing with wound care. So not only do you have antibacterial soap, you can consider betadine. This is, a generic brand of betadine, very diluted betadine. You can sometimes soak dogs, wounds in that. I am a big fan of Epsom salt. Do not allow your dog to soak in Epsom salt for a long time and then lick its foot off. You can, rinse that off if it's going to be the case. You don't want your dog ingesting a lot of Epsom salt. There are a lot of times that I've had feet things going on, whatever may be happening with the dog. I just put them in a very concentrated tub of Epsom salt. Their feet are sitting in there for 5-10 minutes or whatever, wiping that off so the whole house isn't white, and that's helping to heal the wound. These things are important to help heal. Another product I love I don't know if this is called Vetericyn or Vetericyn. This product, Vetericyn. This is actually the ophthalmic gel because I got rid of the spray when I was helping to treat the abscess. But you can buy this at Petco. You can get this at Chewy's. This is an over-the-counter thing that you can spray. It's like the magic blue spray. It's underrated. Go to the store. Make sure you have some on hand. Don't wait until all these things develop. Keep this in your back pocket. This is an amazing, amazing product, and I've used it on various things over the years, and the bottle can kind of help instruct you on what to use it on and how it helps.
We have a bigger first aid kit for dogs than for ourselves.
That is true.
The first aid for us is a few Band-Aids, and that's it, and they're all old.
That's true. Upstairs, downstairs, medicines, all these things.
We could almost do surgery on a dog with the amount of crap we have.
we don't do surgery on dogs ourselves, don't worry. Another thing we really like, we've talked about before, the colloidal silver. I love this brand, the Sovereign Silver. You can get it on Amazon. It's a great spray. This specific one I have labeled and has been emptied. I have diluted apple cider vinegar in here. Also can be great for wound care, great for ears, depending on what's going on. Great way to, get anti-yeast buildup and all of that. But the colloidal silver is another wow factor, okay? It's the Manuka honey and the colloidal silver can really help dogs heal, really help wounds heal faster. And a lot of this is getting wound healing to speed up because the longer the dog has it, the longer you're battling it, the more that it's bothering them, for one, and the more of a struggle it's going to be. If you can intervene on the front end as soon as possible and do some really hardcore care and make sure, you've prevented it from blowing up into something huge, it's going to save you a lot of time and a lot of money. And it could save your dog a lot of struggle. I mean, Max had this abscess for a long time. He wasn't thrilled. It was a big pain in the ass. It wasn't fun for him.
And I will say, from a training perspective, if you have a young dog at home, you may want to get a cone and put it on them to kind of condition them a little bit. Because some of these older dogs, they have been living the life of Riley. They've never had any control put on them at all. And just something as simple as a cone, they will not tolerate. They'll go friggin' crazy. And then you wind up having to medicate the dog the entire time that you're trying to get their wound to heal, just to get them to be calm enough to accept the cone and all the little things we're trying to do to them.
Yeah, no, it's super true. Scott's Malinois is a great example of a dog who will not be coned, breaks into a million pieces. It's a big issue. So yes, if you get them conditioned young, that is great. Let them understand, hey, it's okay that you're wearing this. It's a little bit crazy, but yes, have them accept it at an early age. Last topical thing I want to talk about is Genta-Spray. You can get this at Chewy's as well. Another great spray to have on hand. Again, consult with your vet and make sure you're calling your vet, emailing your vet, having an appointment. You're getting good feedback about this kind of stuff, but that is a super awesome spray too. I would say it's up there with my top 5 ways to heal wounds, especially when you're looking at hot spots or something else. If you are dealing with any of this, you guys, consider a muzzle. Oh my gosh, muzzling a dog that is in pain, that is having a, health issue is just basic standard practice. It doesn't mean that your dog's crazy aggressive. It doesn't mean that, your dog's going to bite you and you have a shitty relationship. But when dogs are in pain, they can act out. So I would highly recommend that you condition your dog to a muzzle before you need it, and then use the muzzle while you're dealing with these types of things. My God, if I pop a pimple on Scott's back, he wants to come at me and punch me. I
need to be muzzled.
Yeah, pain, literally. Scott doesn't punch me. Don't get worried. But
give me a Dilaudid or some kind of heavy tranquilizer.
But literally, these things, you guys, they can trigger the dog. So make sure you're on the front end of all of that and you're keeping yourself safe during all of this care.
And for the sake of the vet and the vet techs, because you may not want to do any of this, you bring it to them and then they're like, hey, we can't do anything. Your dog's trying to bite us. Yeah.
So make sure that your dog accepts the muzzle, understands the muzzle. It's going to keep everybody safe and it's going to help expedite the dog's care. Expedite. Whatever. It's been a long day.
All
right.
Go blue.
Last thing I want to talk about is when you have a wound, how do you make a wound get better quicker? So if you are of the fortunate part of the population who can afford a laser and a high quality laser, 100% look into lasers. A lot of vets are doing laser rentals right now. But if you can buy, there's cool lasers, there's hot lasers, there's different classes of lasers. Do some research. Laser therapy is next level, has great side effects or has great healing effects. It's amazing. Stop with the back and forth. I like the CC loop. Not all vets carry this. It's kind of like a PEMF loop. You just turn on a little button, and I've been using this with my finger, and I've used this a lot. This is a little bit more affordable way to go about things, but it's going to help expedite that healing. The quicker we speed up the healing, the quicker the wound goes away, the quicker the cone comes off, the faster the dog gets back to normal everyday life. So if you have something where it seems kind of chronic or it seems rather serious, a lot of vets will offer laser treatments. Take them up on that. Go in. A lot of vet clinics offer like laser treatments right after a surgery. They're doing some. You'll see an upcharge on your bill. Be grateful that your vet has that service and they're offering it. But lasers, CC loops, some people are super into Reiki, healing coats, PEMF mats, whatever. Look into these things. There are ways to get things to heal faster so you're dealing with trouble for less time. Anything big that I missed?
Well, it helps to have your dog on a good diet so that they recover. They recover and their immune system is good. That's a whole nother to do.
But yes, diet is important with all of this. And really, at the end of the day, it all stems down to how strong is your dog's immune system. Even if it was a really severe injury, if your dog has a good immune system and you're doing proper care and you're keeping that wound cleaned and dry and everything else, it's going to heal quicker. If you guys missed last week's episode, it was super great. We had Bob Salamani on. We talked about protection dogs. Next week, we're going to have an in-person guest. It's one of our cherished in-person clients. They had a very young baby and a very crazy dog. I think the dog's going to be with us on set. It's going to be one you won't want to miss. We're going to dive into their little journey and what helped them and how different their lives looked before we had them as clients up until now. And in the meantime, thank you so much for joining us this Wednesday. We hope that we helped you in some way, shape, or form, whether you had wounds that you're dealing with in the near future or past wounds that you couldn't handle. We hope that we gave you more for your toolbox. Thank you so much. And in the meantime, keep it quirky.
Guys.
Bye, guys.
The views and opinions expressed by the hosts, guests, or callers of this program do not necessarily reflect the opinions of the Studio 21 Podcast Cafe, the United Podcast Network, its partners, or affiliates.